Welcome to week 9 of the Walking with Pathology module of the MSc Clinical Gait Analysis. We are going to be looking at clinical interventions this week and understanding what they are and what the indications for treatment and also the evidence base that we have for the effect that these have on walking. There are some brief documents which cover cerebral palsy, and I would suggest that you further your reading in these areas, but also using the framework of the literature that is available there. Your primary tasks this week are to present the clinical interventions and the condition that you're researching and that you have been doing for the past few weeks, providing the concept for the intervention and also the biomechanical basis for the treatment, alongside both the clinical and the walking evidence from the literature to show the beneficial effects. I would also concentrate on looking at the advantages and the disadvantages, as this gives us the whole perspective of the intervention. We are only looking for a brief 5-minute presentation from each of you, using the guidelines which are provided on the site. The second discussion that we'll have on Wednesday in the virtual classroom is in regards to the clinical interventions used in cerebral palsy. I have provided some material from the UK National Institute of Clinical Excellence on the management of spasticity, and it would be interesting to get the group's views of the framework for the management and your experience of this within both the profession and also your respective area of the country and the world. I think this would be an interesting discussion to see if the concepts that are used both in the UK and in Europe and in other parts of the world are also agreeable based on the evidence or if there are some differences. I look forward to speaking with you on Wednesday.